Good morning, everybody. Thanks for coming. Here we are, ready to go. My wife would call this a manel, and I insisted to my team, I'm not doing this unless there's a woman on the panel, but we're maybe going to get some great questions from the women to kind of raise the bar a little bit later on in this session. Please don't tell my wife that this was a manel. So 3 years ago, almost today, there was a hunger strike by the undergrad students at McMaster University. Does anyone know why? I'm from McMaster, so I was very aware. So the students went on a hunger strike because of the percentage of investments of McMaster University in fossil fuels. And it had moved from, I'm going to make up a number here, roughly 0.96 to a little bit over 1%. And the students saw that it was back over 1%, and they went on a hunger strike. I spoke to the president of the university about this and said, what happened? Well, what happened 3 years ago, end of COVID, gas and oil prices had bumped up. They had not intentionally increased their share or percentage of fossil fuel investments. It had just bumped up. But I am a physician in Hamilton at Hamilton Health Sciences, and I also work at McMaster University. This really piqued my interest because as the Executive Director of the Canadian Coalition for Green Healthcare, what we do is look for opportunities to make the healthcare system greener, to decrease the carbon footprint. And this was obviously a big thing because if you looked at that time at the med school universities in Canada, which there were 18 med school universities in Canada, these are some of the big universities, most of them were moving out of fossil fuels. McMaster, Toronto, UBC, McGill. And McMaster actually, I don't know if the students knew this, was actually rated number 1 in terms of their ESG performance of all of those schools, but it didn't matter. But what was interesting to me as a physician is that the universities were doing this, but the sister hospital foundations, it appeared to me, and I don't want to insult anybody on the stage, it appeared to me we're not doing this whatsoever in Canada. And so that's how we started this project we'll talk about in a minute. We have 3 great panelists today. And this is Gary and Mark and Io. I'm going to let you introduce yourselves. Io, do you want to go first?
Absolutely. Pleasure to be here. Thanks, Miles. I'm Io Olatunji, Director of Responsible Investing at the Canadian Medical Association, which is an advocacy group for the physician community across Canada. Thank you.
Hi, I'm Gary Beliveau, Director of Finance at the St. Justin Hospital Foundation in Montreal. I'm not an investment expert. I'm not an ESG expert. I'm just a numbers guy, and I'm here to explain to you our journey on the matter.
Good morning. I'll be wearing 2 hats this morning. On my day job, I'm the Treasurer and Chief Investment Officer at Concordia University, and I'll be speaking to what we've done with our intergenerational fund with respect to sustainable investment. But as well, I'm also the chair of the investment committee of the Jewish General Hospital Foundation, which is, we're trying to bring that level of sustainability into it. So I'll be speaking from both perspectives.
So about 2 years ago, I reached out to the Trache Foundation, and thank you to the Trache Foundation. They have funded this project that we're doing called Healthy Capital. And, I also reached out to Quinn & Partners for their guidance and support and partnerships. And then we added Ari Campbell to the team. Ari's somewhere here today. Hi, Ari. Thanks for coming. So we started by reaching out to what we thought were the biggest 70 hospital foundations in Canada. And those 70 have $10 billion in assets. Of those 70, 27 of them answered our survey that we sent out. I was quite pleased. I'm sure they get lots of surveys, so that was a pretty decent number. Of those 27, that was $6 billion of assets. I'm going to give you a couple of numbers here of what we found in our initial survey. Of those 27 hospitals, 46% at that time do not include ESG in their investment policies at all. 71% do not have any policy around climate risk specifically. Also, in terms of levers, how they get things done, 88% of these hospitals rely on external investment managers, which is interesting. So the data that we found shows that there was motivation, but it was unclear how to move forward for these hospital boards. And so that's what we're going to talk about today with these panelists. And I'll start with the first section we're going to have today is around the triggers, the mission, and implementation. I'll start with triggers. Please feel free to jump in. First question. What prompted or accelerated adoption of sustainability considerations in your organization and the Foundation's capital? Go ahead.
Yeah, so on my end, I'll speak first to the university, then I'll speak to the hospital foundation. For the university, it was purely strategic. Its university wanted to be a leader in sustainability for across its organization for all of the activities, whether it's teaching, research, and finances. So there was clearly a top-down approach, given that the then foundation that we since rebranded to Intergeneral Fund was where it's an investment vehicle that is where the capital is owned by the university. So we took advantage really to make a message about the commitment towards sustainability. So for that, what triggered that is clearly it was the strategic for the university. And for the hospital, well, the CEO, we worked together actually at the university when he was there. And in terms of trying to evolve the foundation then was ESG, and then we became full on sustainability. And so when he became CEO at the hospital, he asked me to come and join, and really the next step is really about the evolution of the foundation to integrate the whole notion of sustainability.
For us, in 2023, we were on the eve of the major campaign, and we did a strategic planning. And basically, we went through all of the angles of ESG and everything like that. So we wanted to make sure that we were able to talk to our donors. We looked at our internal practices also, green county, paperless culture, hybrid work policy, DEI policy. And lastly, we made it a priority to build a sustainable investment policy because we didn't have anything on it.
Yeah, for ourselves at the CMA, really the genesis was around 2018 when the CMA disposed of an asset of MD Financial, which was a service for doctors. So that was sold to the Bank of Nova Scotia. The proceeds of that was used to set up a fund, which I'm part of, to fund the CMA's activities. So its advocacy activities, its lobbying activities, its aspirations to transform the healthcare system. So with that fund set up to fund those ambitions, it became very apparent to our board at the time that those assets should be managed with the sustainability lens, which you spoke to, Miles. So that was really the genesis of our setting of our ESG principles, our ESG guidelines, our responsible investing policy, and ensuring that those are in line with the CMA's wider guiding principles around engagement, transparency, and impact.
So for those who don't know, CMA, Canadian Medical Association, there are roughly 100,000 physicians in Canada, so this is a fairly big foundation. And I'm forgetting, Io, when that, was that 2015? When did you make that transition?
That was 2018.
Okay.
The policy became operational in 2020.
So it's interesting to me that within the healthcare sector that CMA took a lead on this, and unfortunately it has not become part of the culture yet, and that's partly what we're trying to do here. So a little more on that first question about triggers. Were there any key moments or factors that you'd want to share about making that first transition?
Well, key moments. I mentioned that there was a strategic alignment for the university. But in terms of, I would say, how to go about it in terms of what should it represent? It's really, it was a strong message to say that the whole of the foundation, within the then foundation, will be dedicated towards sustainability. So we got this concept of we call 100% sustainability, and within that we also created this notion of what we call mission-related investments, which is 10% tied even closely towards the university really close objective. For example, indigenous reconciliation is a very academic topic, so that's one of them. And then with the students, we agreed that with their need, they want for that not to be involved into the oil and sector, then we decided to agree that we wouldn't be exposed to the carbon underground 200. So that's how we aligned the mission of the university to the foundation. And for the hospital, it's actually the reverse. It's actually we're trying to use the investment policy to dictate the foundation its missions related to sustainability. So we started with the statement, and that's hopefully that will evolve it to it.
For us, I think that the key factor was the fact that we knew we had some good practices, but it wasn't enough. We needed to go further, and we needed to expand our sorry, I'm not used to talking in English. I live in Montreal, and I'm fully bilingual, but I don't practice it enough. So when I get stuck sometimes on some terms, we needed to make sure that ESG practices were taken into consideration in all our activities. That was the key factor.
Yeah, and for us, very similar to what my other colleagues have mentioned. I'd say for us, there's been a realization that, and I think probably most foundations here will share the perspective that sustainable investing is a journey. It's kind of like you're building as you're doing. So for us, many of the milestones have been after we've actually started implementing our program. So maybe a couple of examples might be, we do have a carbon footprint target, which we established very early. But a couple of years in, it became apparent that, okay, that worked well maybe in 2020, 2021, but is it currently fit for purpose? So we then kind of upped the ante, if you like, and expanded our ambition around carbon footprint to include more than just the listed equities portion of our portfolio and the corporate real estate, to include different asset classes. So the impact of that was to increase the percentage of the coverage of our total portfolio, which is subject to that carbon footprint target. So yeah, I'd say that many of our milestones have been, as we've embarked upon the program, we've realized that what's working and what's not working, and then adjusting accordingly.
Got it. So next thing I want to ask about is the foundation's mission, and I would assume this is true. Does your foundation's mission inform your investment policy and portfolio decisions? And look, don't feel you all have to ask these, but go ahead, answer these. Yeah, go ahead.
Maybe I can get started on that.
Yeah, sure.
So yeah, the CMA has a very ambitious strategy to transform the healthcare system and to impact the healthcare workforce and what we call population health. And that's a long-term goal stretching out to 2040. With our investment portfolio, we continue to strive to see how we can align investment activities with those goals. So maybe a couple of examples might be, for example, in the area of climate change. CMA has a very ambitious program around that. But we can also use what we call corporate engagement to engage companies around those issues. As you'll be fully aware of, Miles, the healthcare system is one of the quirks of it is that it's not only heavily impacted by the impacts of climate change, but it's also contributed towards that. And medical supply chains are a big portion of that. So we could reflect CMA's goal around that, CMA's objective around that, by engaging those pharmaceutical companies to help the healthcare system to decarbonize. I'd say the second area which I'll mention is, even within the CMA's what we call Impact 2040 strategy, that long-term strategy, where there are areas that are maybe not of focus, the investment portfolio can be, if you like, cover those gaps. So one area in the area of population health might be around nutrition. So we do quite a lot of corporate engagement work, a lot of proxy voting work around some of the largest food and beverage companies globally that have adverse impacts on population health through their products, through their services, through through what they sell, what we put into our bodies. So that's an area that's not been a focus of the CMA at large, but having the benefits of an investment portfolio invested in public securities, we can reflect that in that fashion.
Our mission is basically, as a trustee of the philanthropic desire of our donors, so we have to take care of the money that is given to us by our donors. For us, we have to maximize the impact for the families and children of Quebec. So we have to be a prudent investor, and we have to look at, to search for the best risk-return profile, and we feel that a responsible investment approach is consistent with that. And we cannot separate the financial activities from our mission and our role as a very important foundation in Quebec. We need that. We feel that we have a social role to play, and that's why we need to evolve in our practices.
Yeah, perhaps here I'll add the role of stakeholders within the organization. So I mentioned that for university there was a strategic orientation, and it was aligned with, definitely, we have a very active community, students, professors, and overall. And then, so it was definitely, you can, if you look at the demographics of our stakeholders at university, it's very youth-oriented, skewed, and as well, the sustainability top of mind. So there's definitely an alignment with stakeholders into driving the alignment to be 100% dedicated and strategic orientation. So when I went to the hospital sector, and I was surprised to see how it's non-existent. Forget about just the implementation side of things, but just the thinking side of things. And I go back to the stakeholders. I think the stakeholders are much different. They tend to be probably the reverse, maybe not as skewed of the university from terms of demographics. And hence, that's why I think there was that pressure to redefine the mission, to align sustainability is not there yet, but I think to me it's coming as demographics evolve, especially for the hospital sector.
Excellent. Implementation. How is sustainable investment integrated into your investment processes?
Yeah, so in my case, for the university, I mentioned it's 100% sustainable, so it's totally 100% portfolio construction. So we designed two frameworks, one for intentionality and one for asset allocation. The intentionality and that's how we redefine sustainability. It has to have attention. Attention has to be measurable. And attention has to be, at first, either for the planet, for the people, or for the economy. And then it's all tied in terms of specific 100% thematic. And then we married this with the asset allocation and finding strategies within a diversified set of classes. So it's really about intentionality. So it's all through portfolio construction, and all of it has to be measured at. Now, in trying to, for the hospital, because we're coming from a much different level of context, here we decided to just simply use it because we started with a statement. We just use it through the portfolio managers, how they approach sustainability. So we followed them, we measured them to see how they integrate it, and we also try to get a bottom-up approach with measurements as to how potential exposures we have in relevant key topics to the hospital sector. But at this stage, for the hospital, it's just through the PMs.
For us, our challenge is that we're about 80% invested passively. So we knew that our impact was going to be very low, but we still decided to go ahead and we knew we needed to get better, so we developed a specific ESG policy. It is a soft policy. There's no constraints, no limitations, but we do talk about our objectives, our criterias, and what we see. And what we did, so we took a year to develop our policy. We shared it with our investment managers. And then a year after, we asked them to answer a questionnaire that we built from, I built from what the share had done. There was a model questionnaire, so I took that, I adapted it to our situation, and we shared that to our investment managers, and they had to answer it, and then we reported to the board. So even though we're like 20% actively invested, we were still able to give a report to the board to show where we're at. So at least we can say our managers, they do this and that on ESG, even though it doesn't necessarily apply to our portfolio yet. We know that we're working with investment managers that take that into considerations. And the managers, they just want to talk to you about it. They wanted to share the information. They 15 years ago, they didn't want to talk about it. Now they have full teams that work on that year-round, and they showered us with information on ESG more than what we thought. So again, I'm just showing that it's an evolution. It's little steps, but we're going forward all the time.
Yeah, similar to Gary, another plug maybe for the Share DDQ, for those that are not aware of it. It's an open source document from the Shareholder Association for Research Education, and it's almost like a menu of questions which you can ask your asset managers, and you can pick and choose the ones, tailor them as it fits to your organization or your foundation. We send a DDQ out to all of our managers at a time where we're doing a search for a new manager for a particular asset class. And we ensure that sustainability questions are included in there. I think our latest iteration, we have about anywhere between 15 to 25 ESG stroke sustainability questions in them. And the key thing is every manager can answer them, but what are the follow-ups? So we're very kind of rigorous, we're very deliberate in following up with the managers and, asking for, where does the rubber hit the road? Like, show us the proof point, show us the evidence of what you've put in your DDQ, which I think is very, very important to do at the DDQ process. Once we've onboarded a manager, it doesn't stop there. So we continue to do quarterly reviews with our asset managers, and sustainability is always a part of that. I'm always at the table for those kind of conversations, just to, as Gary said, it's always a conversation, and it really does kind of enable one to see how managers truly integrate sustainability into their oversight of the investment portfolio. So I think that's the main way how we do ours. I'll say, in terms of how we report internally, similar trend. We try not to separate kind of traditional investing and traditional invested metrics from sustainability. So when our investment committee, when our board gets our investment committee memo, which we'll talk about our performance, our asset allocation, our returns, impacts of our FX policy, those kind of traditional finance metrics. We do provide them updates on our proxy voting, how we're voting. Are we voting progressively? Are we voting in favor of motions which do serve to further climate ambitions? We do provide them ESG ratings. We do flag to them when there has been a serious degradation in an ESG rating of one of our managers, which again provokes further conversation and ensures that for the board and the investment committee, that sustainability isn't just an afterthought. So for us, it's very, very important to integrate it into our, what maybe you'd call mainstream reporting.
I'm going to jump to risks. What would you say the risks are for a foundation of not embedding sustainable investing practices?
So I'll come from a governance perspective, and then I'll talk about an organizational branding perspective. I think from a governance perspective, this notion about system-level investing, where there's the interdependencies between returns and the health of either the environmental, social, or economic systems that tied in. And it's a more of a long-term issue. We all investments allocators are tend to focus on the market, so on such short-term events are happening, especially with geopolitics. But these system level investment are slowly building itself up and becoming. It's a long-term issue that is prevailing currently, a short-term one over time. So that's one perspective. I think it speaks well, from a governance perspective, with the board is to look at tie it in the return perspective to system level health. But also, I think that to answer your question, respectful from not doing it, I'll take the notion of disclosure. So disclosure often is reversed. We tend to think about the ability, the commitment, and the compliance to make sure that in our case, for example, for the intergenerational fund, we got this 100% commitment. So it's a disclosure issue. You got to make sure that we actually are disclosing it right and we are doing whatever is right. But I think if you're not disclosing it, meaning that if you're not committing at all, you get that issue. It's a message you're sending out that you're on for this organization. It is not important or not of a strategic importance. So then it becomes a stakeholder issue. I mentioned I earlier talked about is I think in case of the hospitals. I think that stakeholder issue right now, it's a demographic that is more tilted towards an older demographic, but over time, that will reverse. And I think this is where that will be becoming top of mind. So disclosure, I think, is definitely a risk of not doing it.
For our part, I think when I got to the foundation 3 years ago, we had about 88 million in investment. Now we're at almost 190 million because of our major campaign. The money is coming in and it's not being dispersed to the hospital as fast because the hospital does the projects and the money doesn't go out. So as our capital becomes much higher, we have to take into consideration ESG criteria. We have to make sure that we take care of that. I think maybe before the money was sent back to the hospital much faster, so our investment wasn't that important. But at the level that it is right now, we have to take care of that. So not talking about ESG criteria would be wrong. So what we did in our questionnaire, although like I said earlier, we didn't have any constraints or exclusions, in our questionnaire, we asked the managers to talk to us about climate, human rights and labor rights, and DEI, what they do about that, and what the investments they do, what they do. So, and donors expect us to do more and more. So we have to be ready to answer to donors. So if we don't do it, we're shooting ourselves in the foot.
Right.
Yeah, I'd answer that in two ways. The first risk would probably be it's a missed opportunity. As I mentioned earlier, with all of our managers, we've had very dedicated, segregated sustainability conversations. But really what that's also allowed is for a deeper relationship with our asset managers, into conversations around various aspects of risk, various aspects of operations, various aspects of their economic views on a number of different issues. So it's almost another lens to see your asset manager, to get to understand your asset manager a lot more. And a lot of that has stemmed from conversations starting with sustainability questions, or in particular climate-related questions. So I'd say the missed opportunity is one risk. The other one, as Gary alluded to, is the alignment with your external stakeholders. So, at the CMA, we have no regulatory burden, as you will, imposed upon us to disclose our investment positions, but we still take the approach that we do disclose them. So our investments aligned with our, what we're advocating for, are they aligned with our mission? And that does carry a huge reputational risk. It's almost like a license to operate risk if you're not in alignment with the stakeholders that you're looking to serve. So I think it's very important to have that alignment there.
Listening to us talking about risk, and it makes me think about risk to human health. And I have to be really careful here because I have a lecture on this, and I don't want to slip right off into the lecture because we don't have time. But just in case people aren't aware, we're talking in part about exclusions. And so, of course, cigarettes were excluded years ago. Weapons are often excluded. Alcohol is often excluded. You're talking about the healthcare industry and what might be excluded. And, fossil fuels in terms of global warming, if you look at all the different greenhouse gases that contribute to global warming, fossil fuels, or CO2 from the burning of fossil fuels, is about 65% of the contribution to greenhouse gas and global warming. And this is where I could slip into the lecture. I could go through all the different ways that global warming and climate change impact human health, from an increase in forest fires, and I think you're all aware of that now. Gosh, we had forest fires up in cottage country this year. And the smoke blowing across, whether you have lung disease, you don't have lung disease, impacts on heart disease. There was the heat dome in Vancouver, 2021, which killed over 600 people. Our system is not set up, our healthcare system is not set up for heat domes. We're lucky we haven't had one in Southern Ontario yet. We really are not ready. We can't have everybody during a heat dome going to an emergency department. And there's also the risks of what you see on the news. Again, Southern Ontario, we've been a little lucky, but if you saw Hurricane Fiona rip through Newfoundland a few years ago, and you can imagine, was their health care set up to survive and to help patients in the storm? The floods we're seeing in BC, the fires we see up north, is your healthcare system set up to withstand these kinds of insults? And the answer is no. So climate change is a big, big issue within healthcare. And so, just kind of getting back to the heart of the issue here, in my worldview, our foundation boards for healthcare should be thinking about the health of the communities and the health of society. And this is a big, big piece. I don't know we're there yet. So I'm going to switch over to challenges and key levers. So challenges through the research that we did and our survey results, elements like uncertainty about returns, lack of board expertise, limited resources. How did you overcome these barriers? Go ahead.
Miles, don't mind, I just want to dovetail to what you just mentioned.
Yes.
I know it's part of the script there, but you talk about thematics that should be addressed. One of the thematics I'm surprised that hasn't been discussed at the hospital sector and is that should be, to me, at the core, is the whole notion of plastic. And I'm not talking about recycling here. I'm talking about how it's integrated and it becomes what we call the next secondhand smoking impact of health. So anyway, to me, above and beyond the environmental issue, I think plastic is even more an issue that the hospital sector should be addressing, which is, I've been trying to find thematics in terms of innovation with respect to alternatives, and it's not much in the field. So I think hopefully that will come as with some innovation from VCs or private equities. But so to answer the question of challenge, I'll take you. So often there's been asked that question around about the implementation stage. But I'll take the question broader. I'll take the station once you actually are in it and maintaining it, because those two you can separate. It's one thing to have the challenges once you try to do it, but then if you don't address it properly in the first stage, you're going to have it throughout the next stage. And in my case, I'll give the example of the university here. The board kept saying all the time, well, we need to compare this then to the market. And if we feel that you're not you're not maintaining with the market, then we reserve the right to switch it. Well, that's not the purpose of it. So you need to maintain. Also, there's a longer term perspective on this. But my point is here is that I think you need to make. This is what we did. We need to maintain off the bat that this evolution is not to be compared to the market. It is to be compared to your strategic targets. It is compared to what you want to accomplish. And as long as from a financial perspective, you can meet your strategic target, and then as well, have the ability to tell a story, what you've done with your capital, then what happened is that the story, then after that, once you implement it, it flows. Otherwise, if you don't establish that, then you keep comparing yourself to the market. And good luck trying to compare yourself to market. And unless you invested in gold or invested in well, now AI has been disrupted, it's hard to keep up anyway. So outside of yes, you have, but to establish that, you have to have this dedicated committee, subcommittee that needs to have time and to talk and talk and talk and talk, and it's really convince them that this is the orientation they have to establish, which allows to really rethink portfolio construction and go that forward. So this way you can then have that alignment of maintenance after that.
For us, lack of expertise wasn't an issue. I think for smaller foundations, it can be, but for us, it wasn't. All of our investment committee members, except one, are investment professionals. Our board president is an investment professional, but despite that, we were helped by Quinn and Partners to go through our process. They did a training session with our investment committee. They helped us develop our responsible investment policy, and they also helped us with the questionnaire. So it can be an issue for smaller foundations, lack of expertise, but even if you do have it internally, you need to get help from consultants or specialists to evolve in the matter.
For us, maybe a couple of ways to answer that. One of the biggest things that we've embarked on in terms of learning for us has been tapping into the other foundations and endowments that are working in this area. So we are part of the SHARE program, which I'd say we participated in that in incremental steps. So initially we were a very passive member of it. Then increasingly we've got to learn from the best practices of other not-for-profits in similar positions to us, and increasingly stepped up our level of participation in that program as our institutional expertise and knowledge has expanded. Similarly, and you talked about the some of the human health aspects out there. We realize we can't solve everything. We realize we can't contribute to everything, but there's a lot of other groups out there that are doing this, particularly on a global scale. So whether you're looking at, from our point of view, stuff like antimicrobial resistance, one of the key global threats to human health, whether you're looking at access to medicines in lower income countries, whether you're looking at mental health and the impact that has, the economic strains that puts on society in terms of lost productivity. There's coalitions of investors working on that, and sometimes you can participate very much by taking a back seat, and they would really appreciate just putting your AUM behind that, just putting your signature behind a particular initiative, we find can drive that forward. Where we do have more bandwidth and capacity in-house, for example, around, as I mentioned, the decarbonization of the healthcare system, particularly through the large R&D-based pharmaceutical companies, that's where we can add or lead or take more of a leadership position in that area. The second way I'd answer your question, Miles, would be in terms of, and I think it was alluding to the maybe the investment restrictions as well. We have investment restrictions around tobacco, as many other health foundations do. We have a very nuanced position or nuanced exclusion around fossil fuels as well as marijuana and controversial weapons. What we found is that when we compare from a pure return perspective, our reference portfolio or our benchmark, if you like, to a customized reference portfolio which reflects those investment restrictions, over the long term, it's often a wash. And a lot of it is due to the price of oil. So like obviously now, this week, what's going on in the Middle East, we'll see a spike. But over an economic cycle, over 5 years, I think the difference in those two reference portfolios, one ESG adjusted, one not ESG adjusted, was less than 15 basis points. So we found that these restrictions we have at the moment, they're working for us. Would we want to go further and beyond that? That's where it gets more challenging, because then you're imposing challenges upon your asset managers to provide a level of performance which is not in keeping with their core mandate. So I think it's very important to have that discussion.
If I can come back on returns, I think 10 to 15 years ago, it might have been an issue because the first responsible funds that were out there were less performing. But it's not an excuse anymore because the products have multiplied, diversified. Investment managers have developed so many products that you can go into to respect ESG criteria, and the returns are there. So it wasn't a myth before, but I think that now it is a myth. You can have decent and even good returns, even better sometimes than the market, even if you have a responsible investment.
Maybe one last comment. I meant sort of only address mine from a university perspective, but for the hospital, I find that one way to mitigate some of the challenges is to incorporate specialized board members that are in the field of sustainability, and that's what we did for the foundation. The hospital foundation, we brought in a couple of sustainable experts in the field, so it balanced out the conversations when we have it.
We have 12 minutes left on the clock. Does that include questions or not include questions? It does include the questions, okay. So, donor expectations, how did that factor into your decisions? Donors pushing back on what you're doing?
No, in the case of, neither in the university, not for the university, some yes, but the demographics is so widespread that it really was not. It was really, I think, a stakeholder alignment was more with the community of the students and the staff and faculty. I think for the hospital, what's interesting is there's a wealth transfer that's coming up for donors, and I think the younger generation, the millennials or the Gen Zs, will inherit that wealth, and I think that profile of donors will change drastically. So this is my perspective. I think it's the behaviors of the donors you have, I think, will change with the wealth transfer that's coming up.
We haven't had pushbacks from the donors yet, but we don't want to wait till we get them to get started. We need to be ready when donors start asking questions to make sure that we're at ease with the answers that we're going to be giving. So we know that more and more donors are asking questions. It hasn't been an issue yet, but when they do push back, we need to be ready.
And yeah, that's not really been an issue for us. We do have a foundation as a legal entity as part of the CMA, which doesn't do necessarily external fundraising. But the question for us would be more applicable in terms of our members, so the physician community in Canada. And yeah, they've very much told us that, you know, the issues which are important to us, which are important to them rather, which are reflected in the CMA's Impact 2040 strategy. So that's areas related to the healthcare workforce, such as administrative burden. That's issues such as the ability for seniors to age with care in place. They've informed that strategy, and that's what we've reflected in our, or tried to reflect in our investment portfolio, particularly around, as I mentioned, climate change, the healthcare of seniors and how they age in place, and administrative burden.
So, I mean, that is absolutely what I would call healthy capital investments. So our final question here. for any beginners in the room. So for those in the room who are beginning this journey, what's the most practical first step that a board or investment committee can take?
Yeah. Sustainability is not transactional, it's cultural. By the way, I was impressed to see that. So leadership matters, and was especially to have 3 accountants on that. Actually, who would have thought that we 3 accountants providing leadership on sustainability here? But so to me, I would really don't. It cannot be a side business and halfway there. To me, if it's about a culture evolution, and so it has to be a top-down approach of changing the mindset, rethinking the mindset about investment, portfolio construction, and permeated it across the organization or the team has been a cultural change. And with that, once that culture is changed, then everything flows. I think the challenge becomes it's just a transactional thing as opposed to a culture change.
For me, the main thing is getting help. Even if you have the internal expertise, you need help from external persons, like bringing in board members or getting in touch with consultant. So getting help, consider your constraints and limitations based on your investment policy, where you are now and where you want to go. You can't go from 0 to 100 like that. But don't be afraid to include the managers. They want to be included, so they have to be included. And one step at a time, just going further and further and evolving.
I would say board buy-in, senior level buy-in as early as possible, but also on every step of the journey. And I think somebody like myself, I'm very ambitious in this area. I do have a lot of kind of, recognize the potential of sustainability in investments. Often that's not communicated to a board because they're looking at a wide menu of different issues. So it's very important to maybe temper the impatience, if you will, to ensure that you're bringing along your board with you. And once you bring your board along with you, and that should be documented in an RI policy, which will dictate how the board interacts with staff. It will probably also dictate how staff interact with external service providers and external asset managers. So I think the RI policy is the important nucleus, if you will, to produce at the beginning. But it's very, very important to have board buy-in, and I echo what Gary said. Definitely get help if you can. We did it ourselves, but I think Quinn and Partners was mentioned. They're a fantastic consultant. They, bring many, many decades of experience of helping not-for-profits to kind of get started on that journey, particularly with establishing an RI policy which reflects the mission and the values and the objectives of your organization.
Awesome. Well, thank you all for sharing your experiences this morning. That was amazing. And I will open up to questions. I don't know how you like to do that. People just shout things out, or?
Yeah, if we have any questions in the audience, please raise your hand and a mic will come to you momentarily.
And if there are no questions, you're going to get a 5-minute plastics lecture. So, over here. Go ahead. Oh, she's getting the mic. Yeah.
Okay. So I'm Sister Janet Speth. I'm a sister of St. Joseph of Toronto with the Catherine Donnelly Foundation. But first of all, I just want to say thank you for a very, very informative presentation. Our community founded 3 hospitals in the city, and now I'm wanting to go back to the foundations to see, hopefully, we have integrated ESG and sustainable practices. And so I don't really have a question, except I need to do more research, and I'd love to attend one of your lectures. But thank you very much to all of you.
I'll just say I do work with physicians in your hospital and in the group of 3 hospitals. There's a lot of good work going on, I can tell you that. In terms of the investment piece, I would chat with Ari. She probably has the inside scoop there.
And who's that? You?
Ari. Right here.
Hi.
Hi.
I'm Allison from the Canadian Medical Association. I'm very happy to see my colleague Io up on the stage. That was a lovely surprise this morning. More of also a comment, and I think, but a reflection on the comment around linking this to strategy. I think what I've appreciated about the Canadian Medical Association, I've been with the organization for, I don't know, long time. And I think the evolution of the strategy and our investment portfolio, of course, catapulted, or the catalyst of the sale of MD, was really significant. And to the point around a slow growth process or a slow change, you know, we're heading into the horizon 2 of our strategy. So it's a long-term view. But what I've appreciated about the investment team is some changes and some links to strategy around, as Io mentioned, around our healthy aging, but also planetary health. And I think as the organization and the strategy evolves, we're going to see more. I lead the Giving and Partnerships team, and I think what's exciting is about the early conversations about linking both philanthropy and corporate giving to the investment strategy. And I think that's going to be an important piece, right? How can we give? And we are in a very privileged position, I recognize. But how can we advance and support strategy both through giving and both through our investment portfolio? So kudos to our team, and thanks for this incredible presentation. Thank you.
Any comments? No? Okay.
My name is Jessica Sinclair, and I'm the Director of Development at Indus Community Services. And we also are taking on a sister foundation, Indus Foundation. And we're fairly new and around the piece of Planet People Economy for Sustainability for taking on a newer board member. What is your suggestion that is the main qualities needed for support when starting a new foundation? When it comes to the board member.
Okay, the support, yeah. So I mentioned the challenges I had, the demographics, but I shouldn't use that term. Oops. Okay, I'm hoping you can hear me.
I think you're okay.
The profiles of the board members for the intergenerational fund originally was, I would say, massively traditional type of investors that saw the market one way. And throughout the process, it's about perseverance to get it through. But I mentioned about this, there's one thing about implementation, but there's another thing about maintaining it after to operate it. And to their credit, they saw that as part of the process, they said, we're not the right profile for you. We're really not. So this led to a 100% board membership change. And essentially I brought in all experts in the field of sustainability. A couple of different profiles as well to make sure that we're balanced. So yeah, I think having specialized board members in the field of sustainability will greatly enhance the ability not only to get it done, but to evolve it and then maintaining it.
I think diversified is important. If you have only lawyers on your board, that's not good. If you have only accountants on your board, that's not good. You need a both. You need entrepreneurs. You need social workers or or people like that. So diversification is also important so that there's a real discussion around every subject.
How far over are we allowed to go?
We certainly have time
sorry.
for more questions.
I was just wondering with Concordia, where you had 100% thematic, sustainable portfolio, if I understood it correctly, whether you found it difficult to find managers to fill out all the different asset classes, and if you would share who some of those managers are, or if maybe that's public information.
No, it's public. You can go on our website. We detail who they are. No, so I mentioned about these two frameworks of capital allocation, one about intentionality, and we put ranges to address the planet side, the people side, and the economy side. And it's 100% thematic. And I would say the only, but it's evolving quite quickly now. I would say the one that there were scarcity in terms of getting strategies and portfolio managers was in the people side of things. So that's why our allocation range was only to 10 to 30% because there was just not much capacity. But that is evolving rapidly now, especially with addressing the health sector from an innovation perspective, which is ironic in our discussion. So to answer your question, I think right now the university is massively growing. You shouldn't be finding yourself, especially from a thematic perspective, not just from a risk management ESG perspective, from a thematic perspective, there should be no issues as long as you're willing to look across the world for thematics.
Are we okay for one more? Yeah.
I think just one more. We have till 9:45 for the session, right?
I'm going to suggest that we head to the back of the room afterwards in case anyone has any further questions.
Okay, thanks very much.
Do I get the last question?
Okay, sure. Okay, go ahead. Go ahead. Yeah.
Gina Dye, I'm the CFO of ChemH Foundation. I love the fact that you're focusing a lot on physical health, but I'm going to put in a plug for mental health. I think climate anxiety is something that's been growing steadily for probably a decade. It's just kind of surfacing right now. I had a bunch of questions, but you've answered most of it. But I'm going to go back to actually another comment about the board and leadership. We have a really great investment committee, and they influence or recommend to the board. So I think getting really buy-in from the investment committee is really important as well. Just a question back to how the hospital's mission influences, and this is specifically for healthcare, obviously, the hospital foundations and, you know, their investment policies, et cetera. And we have exclusions just like you do on tobacco and gaming and a whole list of them. What's your experience in the complexity of trying to incorporate those exceptions into an ESG investment policy? Has it been a complicated process? Like I think that's the first hurdle that we have to get through is those exclusions and obviously the returns as well.
Yeah, I think from my point of view, getting them included into an RI policy wasn't so difficult in itself, but how do you apply that? That's where the challenge comes. Because if you're using external managers and excuse me, and you have the ability to, you don't have the ability to go into what we call separately managed account or segregated accounts. Very, very hard to implement those policies. However, they can be as ambitious as you like. It's just not going to happen. If you do have the bandwidth to go into separately managed accounts, the problem then becomes twofold. Number one, as I mentioned, manager A is pitching their core fund to you. I don't know, so the US equity strategy. What you like in that manager, you're suddenly reducing their pool within which they can fish, right? Like they've given you their performance numbers, and then suddenly you're saying, well, give me that same performance, but with less tools to get there. So that becomes one challenge. And then how do you track manager performance? The manager is saying, I've lagged the market, but ChemH is because you've given me all these restrictions and I can't invest in them. So I think that's one of the challenges. The other one is, maybe the more bigger one, or I should have started with, is how nuanced do you want those investment restrictions to be? Like we have a fossil fuel restriction, but it's implemented in a different way than some of the other smaller pension plans do theirs. Do you have a restriction on coal, for example, which technically isn't in the energy sector, it's in the utilities sector if you're looking at the gig sector. So I think a lot of it comes, I think that's where the board expertise comes into it, having somebody on the board or even a consultant that can, you know, kind of cut through that fog and kind of give you a realistic lens on how external managers can implement that.
I think the next group is keen to get.
I just want to mention, because you mentioned mental health, which is, I think, is, so if you look in the biotech industry field, there are some really cool strategies from PMs that are addressing mental health. So I think there's great innovation there going.
Thank you all so much. And thank you for listening.
Thanks very much, everyone. Our panelists will be available in the back of the room if you wanted to engage with them on further questions.